Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Hi, everyone. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi. This episode is everything you need to know about sexual health and wellness. Before I get into it, the first thing I want to make very clear is that I am not giving any type of medical advice or religious advice for that matter. So if you have any concerns about your health, please speak to your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. This is the Muslim Sex Podcast, because I just happen to be a Muslim woman that talks about sex. So welcome, everyone. And I am so happy and grateful to have on with me Dr. Maria Uloko. Am I saying that right, Dr. Uloko?
Yes, that was perfect.
Okay, perfect. And Dr. Uloko is a superstar in the world of sexual health and wellness. And I thought she was a superstar even before her research came out. And now she's like a superstar. And I am going to just give it up to you. I would love for you to introduce yourself and let all the viewers and listeners know where you are, what you do, what you practice. And then we'll get into the meat of the matter and talk about the amazing research that you and your co-publishers and researchers just published. So take it away, Dr. Uloko.
Awesome. Well, hello, everyone. Thank you all so much for having me. Very honored to be here. My name is Dr. Maria Uloko. I am an assistant professor at the University of California, San Diego. I'm a urologist that's specialized in comprehensive sexual health, which means that I take care of all genders in terms of the medical and surgical treatments for sexual dysfunction. I'm really passionate about quality of life and for my patients, understanding kind of what their ultimate goals are and getting them there. And then I'm also really passionate about the advocacy behind the world of sexual health. There is so much research, there is so much new discoveries to be had, and a lot of that new discovery ultimately directly has positive impacts for patients. One of the things that was really eye-opening for me, I started my training as a urologist, and I dealt a lot with male sexual health, penile sexual health, but it wasn't until my fellowship when I wanted to get a better grasp of all genders that I really saw the huge disparities and the systematic ways that these disparities are persisted and how they directly affect patients. So that's always been my goal, is to figure out how can we improve patient outcomes, improve access to care. And for me, that avenue has been through research, filling in the huge gaps that are there in order to improve our diagnostic and therapeutic treatments for patients.
That is amazing. And that is so needed. And we know how important all that work is that you do. And so I'm just going to get right into it and ask you about that research that you published that was quoted in the Colbert Show. Tell us all about it.
Yeah. So, one of the things that was really exciting for me, or kind of drives a lot of my goals and passions, is just how little there is in terms of research. I really care a lot about patients' access to care and patient outcomes. And one of the huge reasons and barriers of care is just lack of knowledge in the medical community, lack of knowledge on the patient side. And so, it's fun to fill in these gaps. And one of the beauties about sexual medicine is that you work with so many different people. I also collaborate with a lot of people just on the social justice end of things. And after a particularly challenging or frustrating day, I think I was just having a rant with one of my co-author, who's the lead author, or the senior author on the paper, Dr. Blair Peters, who's a gender affirming surgeon. And I was just kind of ranting at him, honestly, about just kind of my frustrations with where we're at in the world of sexual medicine. And I gave him just kind of an overview of like the huge gaps. And one of them came up about the clitoris. And I was like, this structure was first fully defined in 2005 by Dr. Helen O'Connell. But we still don't know how many nerves. Like the number that is thrown around there is actually from a bovine study. And we don't even know the human number. And, based off of his practice, and he is very specialized. He's a plastic surgeon, gender affirming surgeon, and a peripheral nerve surgeon. So one of the only in the world, I believe, at least definitely the only in North America. And does a lot of phalloplasties, which is where we take the clitoris and create a penis from it. And he, because of his ability to work with nerves, he takes those nerves in order to improve sensation. And he's like, they're a paired structure. There's excess nerves. We can sample those nerves and we can actually count how many nerves are in the human clitoris. So this is how the study came about. It's just, sharing ideas. I have my own skill set. He has his own skill set. And then we brought in our third author, Dr. Paige Isabey, who is a gynecologist in Manitoba. And, I think between the three of us, we really wanted to make this research as comprehensive as we could, and touching on three big specialties that take care of the vulva. Plastic surgery, gynecology, and urology. So it was really awesome to collaborate with these people I consider friends already, but then also to make, when we got together, we feel like a ragtag group of people. So it's just wild to see our research, be so publicized and be so appreciated. It really does make kind of the blood, sweat, and tears so worth it.
That's amazing. Well, it's just, it's actually mind blowing, first of all, right? And so if you just want to let the listeners and the readers, viewers know what exactly your research found out about the clitoris.
Yeah. So what we found out about the clitoris is that, the old number of, it has 8,000 nerves, highly sensitive structure, is actually, there's way more nerves than we previously thought. So our research found that the clitoris has over 10,000 nerves, and we say over 10,000 nerves because we were only able to count a specific type of nerve. There are other types of nerves in the clitoris, but that are just too small to count based off of the current technology that we have to actually count nerves. So this is just so, in terms of like, what does this mean for the general population? I think, each of us take this to mean something differently. So for Blair, like I said, he does nerve surgeries. So these are potential treatment options. These are potential treatment options for iatrogenic clitoral injuries down the road. Because first you have to establish anatomy before you can even then start doing treatments. But for me, this was really more symbolic. Obviously, I'm not a nerve surgeon, but I do operate on the clitoris, and I do examine the clitoris, but really just kind of the principle of vulvar anatomy and physiology. There are so many things about the vulva that people still don't know. And as practitioners that are either operating or taking care of people with vulvas, like, we should know these things because these directly lead to patient outcomes. And so this just feels so powerful that we are helping to establish and reestablish more information about the vulva, and drawing attention to the fact that, we in medicine think that everything is already set in stone, that everything's already been discovered, that there's no room for medical discovery when it comes to just kind of basic physiology and anatomy. But if we really look at the history, we actually missed a ton of things and need to go back and go and actually revise it so that we can then treat our patients better and have better outcomes for our patients is really my biggest driver.
Yeah. And like what you said in the beginning, right? Like with sexual medicine, there are so many gaps. And specifically when it pertains to female medicine, right? When it comes to female sexual medicine, I feel that there are huge gaps. And we know that most of the research that's been done on sexual medicine has been done with white men, right? And that's most of our research in medicine has been done on white men. And we know
Yes.
so little about women and so little about women of color that your research has huge implications. And in terms
Yes.
of, I mean, and you know this, I don't, in terms of female pleasure, in terms of just literally, it's, the way that we always describe the clitoris is the tip of the iceberg. But this, the nerves, learning about the nerves and what you said is just, that it's more than 10,000. That in itself tells you that that's like the tip of the, iceberg, literally and figuratively. Right?
Yeah.
I
Yeah.
mean,
The clitoris is a very special structure. And I think, again, it highlights the fact in our medical education that we're not taught how to examine the clitoris.
uh,
This very important anatomical structure in terms of female sexual health and vulvar sexual health, and just yeah, we just aren't taught how to examine it or look at these structures. And it's like, what, why? It's anatomy. It's like us not being taught about the heart or the knee.
yes,
Like, it should all be the exact same thing, but because we have this weird um dogma, this weird puritanical
yes,
culture of where we don't talk about sex, it's like then we're just ignoring science.
yeah,
Like, and that to me just has never felt
yeah.
right. Like, this is science. Like, take whatever cultural nonsense you have and take it away from this, because this is just purely science at this point in time.
And, I agree with you 100%. And to your point, right, about just what our culture is, what the stigma we have around sex and the taboo, even just in this Western society, right, discussing sex. And it's in the media, and what we see is definitely much different than what people actually experience. And there's just so much information, misinformation out there, that it's so important for people such as yourself, researchers that are doing this great work, to have that information publicized and made accessible to everyone so that people can understand what exactly is going on. I mean, to your point, I don't even think I learned about the clitoris. Honestly, even as a gynecologist, I'm like, I don't know. Did I even learn about it? I mean, gosh, I feel like only now, recently, people are starting to talk about it. And, it's only through research such as the one that you conducted, that we're hearing about it, right? And that there was a New York Times article about it. But we just don't discuss female sexual health. There is such a huge taboo. And, we can go into so many reasons why. But yeah, I think that it's really important to have people such as yourself dispelling all those myths. Um, what do you find most when patients come to you? What are things that they often their chief complaint is when they come and present to you?
Yeah. So I'm the director of our vulvar sexual health clinic. So I would say my practice is, in terms of that specific clinic, I would say 50 to 60% sexual pain. And that has really shaped, I think taking care of those patients has really shaped, you know, my views on research and my views and why I do this work. Because one thing that I found so fascinating, so in my fellowship, it was, I went to one of the only, not one of the only fellowship program that also does vulvar sexual health and female sexual
Mm,
health. And
where
so
is that?
San Diego Sexual Medicine with Dr. Irwin Goldstein, who is considered the huge kind of the forefather of sex. He was the Viagra guy, and then after that, he then realized that he kept getting a lot of hate mail from women whose husbands were being taken care of from a sexual health standpoint, but they weren't being taken care of. And he's like, "You ruined my life." And he's like, "Oh," and so from there, he realized that no one was taking care of women, and so he created all of these avenues, including the International Society of the Study of Women's Sexual Health, created a fellowship program. And, anyone that's all the kind of big names in female sexual health all have come from his fellowship, which is, it feels great to be part of that dynasty. But once you start working with these patients and you realize that they have such huge barriers to care, like, because our clinic is cash pay. And so something for me, I've always had like a heart for, I'm an immigrant. I came from a very like disenfranchised background. I used to run a free health clinic in medical school. Like those, that's who I'm always kind of thinking about. I always think about who's not sitting at the
Right.
table. And so, you know, I was taking care of a lot of people with access, and even they couldn't get care. And, you know, it was always the same thing. I've been to so many providers, I can't get a diagnosis and all of these things. And I was like, what is happening? Right? Like we used to take care, I mean, we also take care of really complex patients, but a lot of them weren't all that complex. It was very simple diagnosis and then a very straightforward treatment. And so, you know, I was just kind of perplexed. And when I'm perplexed, I go and back to history and figure out what's going on. And so I went to the literature, I went back in history, and I realized that there are so many structural issues, historical issues that prevent people from getting the appropriate care. And a lot of it stems from education and lack of research. So that's why I went into academia, to educate and to do research, because this is how we make change. So because I see predominantly a lot of pain, including patients with recurrent UTIs, including patients with interstitial cystitis, that has really shaped a lot of my research and a lot of my focus.
Yeah, I definitely hear what you're saying about like the systemic racism that is definitely in medicine, right? I mean, when we
Mm-hmm.
look at the history and like you said, always going back to the history, and there is so much racism within medicine. And I think that that's amazing that you focus on that. I'm wondering how did this research that you did on the clitoris, I'm a little bit curious to find out how has that impacted, say, your career. Are you having more women reach out to you? Are you having other researchers reach out to you? How has this much publicized research impacted you?
You know, that's such a fascinating question. I'm not sure yet. That is, I think it's still in the nascent phase of it getting out there. I you know, I think we were so fortunate that we won two awards at the International
Woohoo!
Society of Study, like the International Sexual Medicine, which is, again, if you had asked me when I was in residency, I was not a researcher. I was someone that thought I was going to go into private practice. I thought I was just going to go to work and go home. Then I found what I really loved. I found things that I'm really passionate about. And I went from I'm not a researcher to I guess I'll figure it out. And that's why I love collaboration,
Yes.
because I have strengths, and I'm also still learning and growing. And that's where collaborators fill in. Like we all work very well together. I loved working with this research team because, my strengths is their weakness. Their weakness is my strength. And so we were able to fill this in. So, we have ideas for more research down the road. But I think the funny thing is that we're all 1 to 2 years into practice.
Right.
So we still have to sit for our boards. So,
You should just get a free
like,
pass on that, right?
yeah, right. I would think, but no, yeah. So, I am having to say no to a lot of things in the upcoming months, just because, like I said, I still have a lot of these kind of urologic obligations
Yes.
that I still have to get
Right.
through. And I understand I'm so privileged and like so luck. Again, I still pinch myself that this actually happened, that I get to sit here and do this so early in my career. And it's wild. I mean, I still remember having conversations and just having like kiki moments, because Blair and I are really good friends, and just being like, okay, let's keep moving, let's keep going, and let's keep pushing. And Yeah, it's just wild. It's wild. So I don't know what the full implications of them yet is. I'm just kind of like sitting in it and just kind of flabbergasted that it actually happened. And one of the most serendipitous things is that I was also then asked to write an opinion piece about
Ooh.
clitoris by a journal of sexual medicine, but they had no idea we were also doing the nerve study. And so it was so beautiful. It just got accepted yesterday. And that was a lot of hard work, sweat, and tears too, because it's an opinion piece. And so, you know, it was hard to actually put into words the passion and the things that I see every day in clinic and what I've learned from history, what I've learned being a Black woman in medicine, all of these things and putting it into writing and how it has directly affected patients was really challenging. And I asked Blair to be my co-author. And so, you know, and we're both very passionate advocates about things. So, you know, sometimes we'd have to like change our language to like appease people. And, but yeah, it was just amazing and beautiful that we actually then got to explain our why behind the research, and it's going to be published like right back to back, and it's
That's
just
awesome.
yeah, it was so
Yeah.
serendipitous. Like this year has been the year of the clitoris in my personal life of just like all things clitoris and research. So
That's great. That's great. I'm wondering, so how does this research impact your advocacy work? I know that you're a huge advocate also for getting, the word out about vulvar health and anatomy and also about reproductive justice. So how does this impact that?
It's actually been one of the most amazing things. So I, I don't know. I used to play sports. I still very much consider myself an athlete. And one of the things I loved about sports is the teamwork approach of things. And I'm also a strategist. I don't know why I feel this way, but I'm also very much like, okay, I need to get to a goal. How can I get that goal? This person's good at this person's good at that. Like we all fill our roles. And one of the things about this work is that there are so many people in different lanes all working and striving for the same thing. So, through this research, I've met, I mean, I was already involved in like advocacy groups, but you know, it's been so great that I get this platform to then say, also, by the way, just so you know, the research for behind vulvar care is terrible. So join us. Patients are suffering. You know, what you think you don't know, and you don't know what you don't know. And I'm letting you know that there's a real huge issue, and we all have to band together to fix this. And to have that platform, I mean, there have been a lot of reporters that have been really interested in this. And, you know, initially they were very much like, well, what does this mean for patients from like the long term? And I was like, okay, that's a Blair question. But as a me person that's constantly seeing patients that are, you know, crying in my office every single day because of the trauma, the medical gaslighting that happens, and just living with chronic pain that isn't technically chronic if they just had appropriate diagnosis and
Right.
treatment. I like have like taken off on that and just being like, hey, listen, we're doing a bad job as a medical community. We need to be doing better. And so having, you know, media to be able to then have that
Yes.
platform, advocacy groups then, you know, feel more empowered to then, you know, take off with that narration. It's been one of the most beautiful things. And I just can't thank everyone enough that is involved in this, like in their own way. And I feel like I play a very small part in the greater good. I actually have a mission statement on that I look at my mirror every day. See, I will probably cry. Like this year has been like a lot in terms of that, like literally um, that is I am here, like the reason I do this work that I do, the reason I'm like, you know, pushing myself to so many things is I'm here to change the narrative of medicine in order to create a more equal and fair platform for everyone when it comes to sexual health. And you know, that mission statement, I'm living it right now, and that is
Awesome.
I'm so freaking lucky, like, and so blessed. It's amazing.
I think that is amazing that you have that mission statement and that that you're living out your why, right? Very few of us get to live
Yeah.
out our why or even know our why. So I think the fact that you know it and you're living it, but you know what the amazing thing is, it's almost like you're manifesting it, right? Because you look at it every single day. So then the things that you do, the opportunities that come your way, they almost come your way because you are living out your why. So it's almost like the universe is being attracted to
Yeah.
what your why is and lifting you up so that you can do what you feel your purpose is. And I think that's just awe-inspiring. So thank you for doing all that you do. I think that is just amazing.
Oh, well, I am a small player in
No,
this big
yeah,
game.
no, I think that's great. And what's very important, right? I think also is for girls of color to see you, right? So I know that you and I met at a conference at the American College of Osteopathic OBGYN conference this past March. And, usually when I go to these conferences, I usually see, people that are white, and there's nothing wrong with, and I appreciate everyone, but for me to see you up there, was just, I thought this is the woman that I need to follow and I need to know because she is just amazing. But not only are you just an amazing as a person, but what you represent and I think the hope and the courage you bring to other women of color, I think is very, just can't be downplayed. I think that you bring a lot to the table, and I'm so glad that you are at the table and that it becomes more inclusive, right? And so when people see you doing the work, then they become empowered to also do the work. And and we all benefit, right? We all benefit from the research that you've done with Dr. Blair, and I think it's only, it's a win-win for everyone. um, I'm also interested in knowing, what you feel about, and this is a whole nother topic that I have gotten, and I don't want to delve too much into it because I know that this we could talk about this for hours. Is FGM, female genital mutilation, and how that plays a part in the clitoris, right? And the research that you've done, and how perhaps reconstructive surgery could help these women, and I just wonder, and I don't know if we have an answer to that, but I'm wondering if you would know, based off of the research and the nerves that you've seen. And I don't know, I'm just curious to know, and I don't know. Yeah.
Yeah. So in terms of that, we comment on this in the paper, is that this here, the this understanding how many nerves,
Yeah, of
and like, I'm going to preface it again. I am not a nerve surgeon.
course.
I'm not a
No, no.
peripheral nerve
Yeah.
surgeon. So Blair would be the better one to answer this question. But from what we talk about is that, just understanding
Yes.
anatomy and physiology first is what's going to lead us into more surgical innovation. And it's people like Blair, Dr. Peters, who has is just one of the most innovative and hardest working people I've ever met, and has such a heart for humans. And that is that those are the people that are going to be changing the surgical field, that surgical narrative that's going to be pushing the envelope in terms of the potential for recovery after FGF, during the repair, for female genital mutilation. So, as of right now, this number, if we kind of just think about it as this is our
Yeah.
baseline, this is step
Right.
one. And then, hopefully we'll have long, fruitful careers, where we can then start increasing our innovation. But this is where having a lot of players mixing people in the field, because people are bringing in ideas. This is the whole renaissance of research to me, of like, okay, we can actually be creating such amazing things. Like, how wild is that? Like, not the saying that we're going to be the next penicillin, but like, when I was doing my retrospective chart reviews in residency of 6 patients, like, that wasn't all that fun. But the fact that we could potentially create something that's going to change the narrative and change how we do things in medicine is amazing. and just so exciting. And it's not going to be just the two of us. It's going to take a whole village. And there's so many people that are so brilliant, and have such different ideas. Like, that's what I loved about this project, is that it was cross collaboration between so many specialties. And it's so funny because what I've noticed in medicine is that everyone works in
Yes.
silos. And it's even funnier as a urologist, because we have decided that we have the urethra and then everything else is gynecology. I was like, y'all, we should be working together. Like, this is all of our domain. And if we all work together and pulled like all the things that we know, don't know, fill these things in, this is how we make progress. This is how we help patients. And I think is always having, what is my North Star? And it's to help patients. That really does ground me.
That's amazing. I love that. And I agree with you so much that everyone does work in silos, right? But just look at what amazing work you put together when you all collaborated together, a urologist, gynecologist, and a nerve specialist, right? A reconstructive surgeon as well. So you also do gender affirming surgery at UCSD. Talk to us a little bit about that.
So, yeah, so I actually I don't do the gender affirming surgery anymore. I was trained in it in residency, but I didn't do any formal post residency training, other than a little bit of vaginoplasty. But what my focus is on the research side of things, because I have the understanding of what happens during the surgeries. I know exactly the questions that I can be asking, because to me, this is all just anatomy. Obviously it has significance for the individual, but I look at it from a scientist standpoint of, okay, well, that structure is taken out during this procedure. That's the structure that I need to examine. It's just I think about it from a very technical standpoint. And the other thing too is I like to bring humanity into medicine. So and this is where diversity matters. So I come from a very non-traditional medicine family, poor immigrant, just I made my way here. And because of that, I have a lot of life skills. I have a lot of life lessons, and practicality. And it's like, okay, well, if you look at the literature, we have so many articles about like the aesthetics of the genitals, which is very important, the in theory functionality of the genitals, which is also very important. But how are people actually having sex? Like, how like we spend so much time to create these new genitals and give people the confidence in life, but then how are they actually learning, and very much like, and I think I know this because like cis people don't even know how to have sex appropriately because of our very, not appropriately, but they don't even know how to have sex to the point where they're actually having pleasure. And so I can't imagine having brand new genitalia and learning how to have pleasure, right? And so that's where my research focuses into is, looking at the post-operative outcomes and the quality of life. Quality of life is, sex is about quality of life. And it can be also about making life, but I look at it from the quality of life standpoint. And so that's where, a lot of my research questions are coming from, is like, how are we actually supporting our patients after they have gender affirming surgery? And a lot of people just haven't thought about that. They just really thought about, okay, is it the biggest, the best, da, 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 da. These are all very important. But, I then have people coming into my office saying like, how do I use it? And I'm like, okay, all right, let's work through this. Let's figure this out, and so that's what gives me joy. And building that into my practice has been very, very just awesome. I love my patients.
That is awesome. That reminds me actually of something one of my friends once said. This, it's a little bit, it's analogous to that, where, when you always have like single people, so you're always trying to set them up. And then finally, when they get married, nobody asks about them after they're married, right? Like they just try to set them up, but nobody cares afterwards. So it's kind of like what you're talking about. People do the surgery, but then nobody asks, how are they doing after that? What happened? What happened to them? And what's going on with their lives? So it's a very good point, right? And nobody really thinks about that. So I think that's very important. I was just speaking with Dr. Rahman. I'm sure you probably know her.
Love
Yeah,
her.
yeah. So I
Yeah.
just was speaking with her, and she was also speaking about implicit bias and how we don't talk about that, and women of color and things like that. And I'm wondering, have you noticed that in your research as well, with different research that you've looked at in terms of vulva and exploring that, female genitalia?
Absolutely. Absolutely. If we just look at the history of gynecology, it is a specialty that was rooted on misogyny,
Yes, yes,
paternalism, and
absolutely.
racism. Um, they did a lot of their experimentations on Black women. And so, if you just look at it from that lens, that's how this whole field
Yeah,
started. And,
yeah,
it hasn't gotten better. And if we look at then NIH funding for research, it has essentially been very exclusionary to just all women, and all minorities, whether it's gender minorities, whether it's sexual minorities. That's just how it has been, to the point where they've had to create mandates in order to ensure that funding is allocated appropriately. But that is now undoing so essentially the basis of medicine doesn't include anyone other than cishet
yeah,
white men. And so that, when you just like think about it from that standpoint, again, I just think of research as
yeah,
advocacy, is like I'm actually getting to bring in different voices, bring in different people, like, and do this
yeah,
research in an ethical and safe way, where I'm doing it for the greater good, and not exploitation. That's the thing. That's the big
yes,
thing that we also really focus on and hyper focus on, are really always thoughtful. And we're never going to get it right. Like, we're not always going to get it right. And, having a lot of humility of, I think having intention is good, but also understanding that sometimes your outcomes and, may hurt people, or, or some people might take it the wrong way or whatever, but at least being able to say, okay, I see that. I'm sorry. This is what I meant, and I will do better next time. So, as we're moving forward, as I'm doing a lot of research with all genders, with all of these things, like, I'm not always going to get it wrong. We're not always going to get it right. I'm not always going to get it wrong, and I'm not always going to get it right. But it's having humility, understanding that we're always trying to include everyone,
yeah,
and trying to do our best. But it is very exciting that I get to actually say who is not seated at the
yes.
table, and then change that narrative from there.
That's awesome. That's awesome. And I'm so glad that you are out there and that you're doing all this research, such important research, and especially for people that have been left behind, right? And people that have not ever had themselves represented and that have not had research done for them. And so I think it's so important that you're there doing that research. And of course, we don't want to put the burden all on you to get all this done. It behooves all of us in medicine to work toward the same goal. And I just absolutely love your why. So, I know that we're nearing the end of the show, but I'd love for you to state your why again, because I feel like you are just the embodiment of it right now. And I just think that it's so important to have, a why. And I really appreciate that you have a great one. So if you don't mind sharing it again,
Yeah.
I'd love to hear it again.
Yes, and so this practice came from Kemi Doll. If I don't know if people know about her, but she's a professional physician coach, predominantly for women of color, and this is a practice of hers. But of understanding and naming your why. And so my why is that I want to change the narrative of sexual medicine, to increase patient outcomes, and to increase patient access, and make sexual medicine more diverse, and ultimately help people. That's really what it is.
And that's what you're doing. So I think that that is amazing. I think that are you again going to be to the American College of Osteopathic OBGYNs? Yes.
Yes, it's in San Diego.
Yes.
So yes, I will be
Yes.
there.
I was asking them about sexual medicine and they said, oh, we have a speaker. So I was like, I knew it had to be you. So I'm super excited because
No,
I'll be there again. So I'll get to
yeah,
see you again in person. That'd be awesome.
excellent,
Yes.
excellent.
Yes.
Yes, we should definitely connect when you're here.
Absolutely. So, well, thank you so, so much. Are there any takeaways or anything that you'd like for the audience and the viewers to know before we are done with the podcast? I mean, I just, first and foremost, I want to thank you for your time and, all the time and energy that you put into your research and your love of sexual medicine and how you're furthering the science behind it and the research behind it. I want to thank you for everything that you're doing, and I really appreciate your work. But I'd like to give you a few moments, just if you'd like anything that you'd like to say. And please tell people how they can follow you, how they can get in touch with you, and just appreciate everything that you've done.
Oh, well, thank you. Let's see. I am, yeah, I just, again, I'm like pinching myself. I just am coming at this with a spirit of gratitude. Just, I can't believe that 1 year after having this idea that it's come to this, could never have thought about that. And really, I call everyone to join us in the research fight and join us if you have a clinical question, if you've ever thought about something. Again, I was someone that never thought of myself as doing research or calling myself a researcher. And, fast forward a year, I'm winning international prizes in research, which again, if you had told me 2 years ago when I was finishing residency that this would be the case, I would have laughed in your face. And so it's just like finding what you're passionate about. And for me, the slog of research makes it all worth it because there is a mission statement, because there is a greater good and a greater purpose. And it does help that I'm doing it with people that I really do love and cherish and have a lot of fun with, and then we work well together. But yeah, we would love to have more people in because there is just so much that needs to be done. And there's just amazing organizations that can help with this. One of them is ISWISH. The other one is we have for any medical students or anyone that wants to get involved in the research from a medical student standpoint or fellow standpoint or trainee standpoint, we have SMRT, which was started by Dr. Rachel Rubin, who's also one of the big 4 leaders in sexual health. And that is, we meet on the first Sunday every month to discuss research ideas. And it's just been so fascinating and awesome to see such, our young learners getting involved and ready. And then if you want to follow me on social media, I've been bad at social media because I've been working and studying. But my public Instagram is Maria Uloko MD. And then my Twitter, I think let me just make sure, is at Maria Uloko. And then if anyone has any questions, feel free to DM me. I will find them at some point.
Awesome. You're awesome. Well, thank you so, so much again for joining us and letting everyone know about the research and all the hard work and information that you're putting out there for us. So thank you so much. And well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So please see your healthcare provider for any concerns you might have. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.